We'll start basically first today with miasms, then going to reactions of mind and understanding miasm at the level of mind. Many people will have tendency that give only importance to mind, but let us be very frank, mind cannot exist without body and body cannot exist without mind. Both of them are equally important. And when we prescribe, when we say that we are going to prescribe for the individual, we have to select both. I'll ask you one question. Hahnemann has given importance to law of similia or theory of miasms. Relatively, which is the thing which he considered more important? Theory of miasms. Because if you see the books, Lives and Letters of Dr. Hahnemann, by Bradford or by Richard Hale, you find that he has written letters where he says that his law of similia was perhaps incomplete in absence of understanding of miasms. So miasms will help us to understand a particular individual, why he behaves in such a situation, why his body is producing certain kind of disease. Now same thing the genetic scientists have been saying, that yes, you carry the tendency for particular disease right from your birth. Am I right? We can't change the genetic constitution of the person who is born, because genes what he has to get have been already there. But the modification can be done by our medication so that it does not produce the symptoms to such a that level or a greater level. For example, if all of us are exposed to a particular, say, any kind of factor which has tendency to introduce some disease, all of us will not react in the same manner. If you go to a party, you will find 1 or 2% will develop symptoms, not everybody. If there is a financial loss, one person, how will he say, okay, I must regain whatever I have lost. The second person will say, my entire life has been ruined. Third person will say, if I have lost 1 crore, I'll earn 2 crores. You see, the reaction of each individual is different. You will find in the same individual, at one particular time, the financial loss or a particular stress factor may not affect him so much as it may affect him at other stage of life. Why it is so? You will come across somebody, there's a death of very near and dear relative. The person does not get affected that much at that particular time, and maybe 10 years later there's death of somebody known to him who is not a relative, but still you find that person has got tendency that he will think constantly about that. Why it happens? The reason is that your tendency to get affected by certain factors is also genetically ordained. What happens? The time there has been theory which explains about switch on and switch off theory. Suppose if your genetic tendency is switched off, that this particular factor will not affect you in, say, age of 35 to 45, that factor will not affect you so much. But after the age of 45, if it is switch on, then you will get affected by that particular individual. So all these things you will find have been, to some extent, I will not say completely, to some extent understood by Dr. Hahnemann, and we will go through some important aspects of what Dr. Hahnemann has been saying in his writings. What do you understand by miasms? See, we are not in a classroom, we are more on postgraduate level, we are going to have interaction. My aim today is to give you a line of thought so that we can discuss on that line. It is not only that you are going to learn, I am also going to learn. From each seminar, from my students, I learn. In fact, my students and my patients are my best teachers. So, coming to what is the meaning of miasms. What do you understand by miasm?
It is a genetic tendency of that individual.
Okay, right. It's a genetic tendency of that individual. We can say, definitely.
Peculiar corporeal constitution.
Okay.
It is dynamic causative factor of.
Okay.
So it is intensity of perception of the situation.
Okay. See, all of them have given their own words, their own understanding. This is what Hahnemann said, individualization. To each question, what you ask, the patient will also give his own words. How you are sitting, that again is dependent on your miasm. How you are behaving, how you are reacting, that depends upon your genetic constitution. Now, we proceed little further. Let us come to a situation. Say a situation where you are in a bank. You will find that you have gone there with your child, and a stranger who is seeing you for the first time will come and see, and he immediately recognizes, "Acha, ye aapka beta hai." And many times you find a stranger will say, or other person will not be able to recognize that this is your child. It happens. Then you find patient will come and say, "Sir, nobody in my family had diabetes. From where I got it?" Whereas other patient will come and say, "Sir, diabetes is running in my family. Can you tell me what precautions should I take so that it does not affect me?" Somebody comes and says, and we use the term first generation diabetic, because nobody previously had diabetes in their family. Brothers differ so greatly, not only in their appearance, but also in their behavior, in spite of being brought up in the same environment. Two sisters suffer from totally different diseases. One may possess a trait or a taste or an attitude that may be totally different from parents or siblings. So you find there's a saying in Hindi, "साधु के घर शैतान पैदा हो गया." Why? There has to be some reason. What is it that makes the reaction of the people in the same family? Now, when we say same family, we are talking of somewhat similar genetic constitution. Different, and two different people with different genetic constitution from, say, different families behave in a similar manner, in a same situation, at different place, at different time. You find this happens? Why it happens? We'll understand. We'll just watch this. I'm going to show you a lot of clippings.
37 striking the south tower, the other, of course, the north tower. Information being handed to me right now, if you pause just for a moment, a senior government official speaking on condition of anonymity said the eight...
One of those almost looks like one of those planned implosions, but of course there was nothing planned, and it was not an implosion, as you see.
That was the first tower collapse that we
There
just
we go.
saw.
Here's the second one
This
coming.
is the collapse of the second tower.
And so now as we stand here, both towers, the tops of both towers are gone. Behind somewhere, that plume of smoke that continues to rise over.
There was a terrorist attack. Now, imagine if you were there inside. What would have been your reaction? Panic. Scare. Confusion. And how you would have brought your reaction to expression?
Escape from that situation.
Escape. Yes. How do you, what was, like, if you were there, how would you have thought of escaping?
So the shortest way to come out of the building